The quiet hum of a busy waiting room, the familiar scent of hand sanitizer, and the rustling of paperwork, these are the hallmarks of GP surgeries across the United Kingdom. For millions of Britons, their local GP practice represents the crucial first point of contact with the National Health Service, a relationship that has remained largely unchanged for decades despite the evolving healthcare landscape. But come April 2025, this relationship is set to undergo significant transformation as the Department for Work and Pensions introduces sweeping changes to GP rules that will affect patients, practitioners, and the broader healthcare ecosystem alike. In a landmark announcement that has sent ripples through the medical community and beyond, the DWP has confirmed a series of major modifications to how GP services will operate, how patients will access care, and how the vital connection between primary healthcare and social welfare will function. These changes come at a critical juncture for the NHS as it continues to navigate the aftermath of global health crises, mounting resource constraints, and the growing healthcare demands of an aging population. The upcoming reforms represent the most substantial overhaul of GP services in recent memory, aimed at streamlining processes, enhancing efficiency, and ultimately improving patient outcomes. Yet, as with any significant policy shift, these changes have sparked intense debate among healthcare professionals, policymakers, and the public. Some view them as a necessary evolution to safeguard the future sustainability of the NHS, while others express concerns about potential disruptions to care continuity and accessibility. What's clear is that these imminent changes will touch the lives of virtually every citizen in the country. Whether you're someone managing a chronic condition, a busy professional seeking convenient healthcare access, or a caregiver navigating the system on behalf of a loved one, understanding these reforms is essential to ensure you can continue receiving the care you need without unnecessary complications or delays. This exploration delves into the heart of these upcoming changes, unpacking what they mean in practical terms for different stakeholders, examining the rationale behind them, and offering guidance on how to prepare effectively. By the end, you'll have a comprehensive understanding of what to expect when April 2025 arrives, and how these shifts might reshape your personal healthcare journey within the NHS. Background and context. To truly grasp the significance of the forthcoming GP rule changes, we must first understand the complex landscape in which they're being introduced. The relationship between the Department for Work and Pensions and the National Health Service has always been multifaceted, with interconnected responsibilities, particularly in areas where health and social welfare overlap. This intersection has become increasingly important in recent years as policymakers recognize the profound impact health status has on employment capabilities, benefit requirements, and overall economic productivity. The NHS, since its inception in 1948, has evolved through numerous reforms while maintaining its core principle of healthcare free at the point of use. General practitioners have long served as the gatekeepers of this system, providing primary care services while coordinating patient journeys through the broader healthcare network. Over time, the responsibilities placed on GPS have expanded significantly, extending beyond purely medical duties to encompass various administrative functions, including the provision of medical evidence for welfare claims and fitness to work assessments. The Department for Work and Pensions, meanwhile, has seen its own evolution in approach to health-related benefits and support services. The past decade has witnessed several iterations of work capability assessments, changes to disability benefits criteria, and shifting policies around medical evidence requirements. These developments have often placed additional burdens on both benefit claimants and medical professionals, with GPS frequently caught in the middle tasked with providing medical documentation while simultaneously managing their primary clinical responsibilities. Recent years have highlighted several critical challenges within this system. Lengthy waiting times for appointments, inconsistent approaches to medical evidence across different practices, and growing administrative workloads for doctors have all contributed to increasing strain. Patients with chronic conditions or disabilities have frequently reported difficulties navigating the dual requirements of healthcare and benefit systems, sometimes facing contradictory expectations or duplicative assessments. The COVID-19 pandemic further exposed and exacerbated these systemic weaknesses. As GP practices rapidly transformed their delivery models to accommodate remote consultations and infection control measures, the traditional processes for managing DWP-related requirements became increasingly unwieldy. Simultaneously, the pandemic created unprecedented pressure on welfare services as employment patterns shifted dramatically, and many more people found themselves reliant on state support, often for health-related reasons. This confluence of long-standing challenges and acute crisis provided the impetus for a comprehensive review of the interface between primary healthcare and welfare services. Beginning in early 2023, a cross-departmental working group comprising representatives from the Department of Health and Social Care, the Department for Work and Pensions, the British Medical Association, and patient advocacy organisations undertook an extensive evaluation of existing systems and potential alternatives. Their findings, published in September 2024, highlighted significant opportunities for improvement through digital integration, streamlined processes, and clearer delineation of responsibilities. The report emphasized that the status quo was unsustainable, placing excessive burdens on GPs while failing to serve patients efficiently. It recommended a series of interconnected reforms designed to create a more cohesive, user-friendly system that would better support individuals with health-related needs while reducing unnecessary administrative overhead. The changes announced for April 2025 represent the culmination of this review process, incorporating feedback from extensive public consultations and pilot programs conducted across several NHS trusts. They aim to address long-standing inefficiencies while preparing the system for future challenges, including the continued integration of digital technologies and the management of an increasingly complex patient population with multiple long-term conditions. As we examine these reforms in detail, it's important to recognize that they don't exist in isolation, but rather form part of a broader strategy to enhance cooperation between health and welfare services, ultimately seeking to improve outcomes for individuals whose lives are affected by both systems. Core changes to GP services structure. At the heart of the April 2025 reforms lies a fundamental restructuring of how GP services interface with the Department for Work and Pensions. This reorganization seeks to create clearer pathways, reduce duplicative work, and establish more specialized roles within the primary care ecosystem. Let's examine the key structural changes that will be implemented. The most significant shift involves the creation of dedicated DWP healthcare liaison units, DLUs, within regional NHS frameworks. These specialized teams will assume primary responsibility for managing the medical evidence requirements associated with benefit claims, work capability assessments, and other DWP-related processes. Each DHL will be staffed by a combination of healthcare professionals, including doctors with general practice experience, specialist nurses, occupational health practitioners, and administrative support staff, all trained specifically in the intersection of health and welfare policy. This represents a substantial departure from the current system, where individual GP practices handle DWP-related requests alongside their regular clinical workloads. Under the new framework, when a patient requires medical evidence for a benefit claim or assessment, the request will be routed directly to the regional DHLU rather than to their personal GP. The DHLU will then access relevant medical records with appropriate consent, conduct specialized assessments if necessary, and provide standardized documentation to the DWP.